Hi, my name is Alexandria Douglas, and I'm going to be showing you functional exercise using dual task balance on a Bosu ball to improve balance and posture control in a collegiate tennis player. We're going to start with our collegiate tennis player on a Bosu ball, round side up. Got it? Okay. And for dual task, we're going to have her swatting at the ball like she's deflecting her opponent's tosses. One, two, three, and four. Ooh. And we're going to have the patient continue this until she feels comfortable on the Bosu ball and is able to stay up there and swat at her serves without falling down. When we progress, we'll be flipping over the Bosu ball, round side down, and repeating. So we're going to have our player get up there. Need help? Let them collect their balance. Are you okay? Mm-hmm. And just repeat, we're going to have them deflect the balls once again. Slower, maybe. There we go. Good job. And then we'll perform this progression until they're comfortable and then return them back to play. Hi, it's Alex again. I'm going to be showing you joint mobilization for extension of the wrist, and then joint mobilization is used to improve extension of the wrist. We will be performing a basic lie on our patient. We will have our patient sitting with their wrist over the edge of a table, and I'm just going to take my right hand to stabilize their arm, and then take my left hand and grab the top of their hand. For our glide, we're going to be performing grades 3 and 4. So on 3, we're just going to kind of push down so that the bones of the wrist move anteriorly and go as far as the wrist allows, and then while returning to neutral. Then as we progress to grade 4, we're going to go as far as allowed once again, and then we're just going to push a little bit farther to get that extension. In each grade, we should perform them for about 15 seconds and have 3 reps. If your patient doesn't feel any discomfort, progress your grade to grade 4 from the grade 3 for the same 3 reps and 15 seconds each.
Hi, I'm Gabriela Vades, and we are going to be doing an external shoulder external rotation for an overhead throwing athlete. So for this exercise, we're going to have our elbow at a 90-degree angle, and for the exercise, we're going to quickly move up concentrically and slowly lengthen eccentrically 3 to 5 seconds down, and the eccentric is going to be the most focused portion of it, and this uses less motor units. So for this one, we'll do go up and then slowly go down, and go up, slowly go down, and we'll do this for 3 to 10 repetitions. Hi, it's Gabriella again, and today we're going to be doing a plyometric exercise for a soccer player with a pulled hamstring. This is going to occur in the later stages of rehabilitation to strengthen the hamstring. So we're going to be doing a squat jump. So for a squat jump, we will start in a squatting position and explosively jump up, and then we'll do 3 sets of 10 for those. So.
Hi, I'm Gabriela Santizo, and for a PNF stretch, I will do a contract relax technique to improve the flexibility of the internal rotator muscles. So with this technique, the client will contract the external rotator muscles while I put resistance. And while she contracts the external rotator muscles, the reciprocal inhibition is fired, and it will cause the internal rotators to relax. So while we keep doing this, the flexibility of the internal rotators will gradually increase. And I'm going to have the client contract for 10 seconds and then relax for 10 seconds. So I'm going to hold her arm in a 90-degree angle, and I'm going to be putting resistance over here, and she's going to try to push forward, and that's going to contract the external rotators. And for 10 seconds, you're going to do this, and then we're going to relax. Ready? So you're going to contract right now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And I'm just going to push. See how much she increased in her range of Lisa, and we'll go over functional exercises to develop neuromuscular control in a collegiate wrestler with an elbow injury. So first, we're gonna have the client start with some planks. Open chain exercises are usually used for upper extremity, but because wrestlers are always in contact with the floor or their opponent, I chose to use closed kinetic chain exercises in order to stimulate the articular receptors. So stimulating the articular receptors will help with the feed forward and feedback controls. Also, in the plank position, the elbow joint will be in a vulnerable position. So in this way, we can work on strengthening it and with balance. And after we get that under control, we will later move on to more sport-specific movement patterns. So the client will start on her knees, and then she will slowly go into a plank position. Hold it for 1, 2, 3, 4, 5 seconds, and then go back. And she's gonna do this 10 times for 3 sets. So go 1, 2, 3, 4, 5, and then put your knees down. And then both arms, same time, and then to plank position. 1, 2, 3, 4, 5. So from this, we will progress into sprawling. So the client will start running in place, and then they will go into a sprawling position, which entails, you don't have to do it right now.
Okay.
But, it entails the wrestler going down on extended arms, and then landing with their legs open, and then you're gonna go back up, and then run in place and do the same thing. So, and then all of it is fast. So you're gonna run, and then just fall, down, up, and then keep running.
Okay.
So all of this is fast paced. Please keep your arms extended when you're going down, and we can do 3 sets of 10 for these exercises. So, 1, 2, awesome, look up. Awesome. So the client, while going down, was in the same position as in the last exercise, just with the added impact of the floor. And the lower extremity was also integrated. And of course, these exercises will be done after the client can have full range of motion of the elbow, before having to do a plank or anything. Full range of so the client can move it all without pain.